Well, it's not like quite remembering the Kennedy assassination or the moonshot. This was simply having a luncheon with two people, Dr. Pennington and myself.
And we were invited by Pat and Larry to come to a sort of a sentinel meeting that we actually held, as I recall, in Lafayette. And Dr. Pennington and Dr. Ansari, Dr. Montravati, myself, Larry Einhorn, and Pat were there.
This really hadn't been done well before. The only other group similar to this was the North Central Cancer Treatment Group, in which the Mayo Clinic was the center, and they had community outreach.
The initial idea was to build a bridge to connect the academicians at Indiana University, the faculty members dedicated to research, to build a bridge between them and community oncologists such as myself.
And was really during probably the second or third year of his organization that we became a cooperative group and started doing clinical trials, which is the main mission of the Hoosier Oncology Group today.
The HOG gave us, as oncologists in the community, the opportunity to actually feel like we were contributing.
But we wanted to create trials that could be done in the community in which we could share the data, but also share the conception of the trial, the writing of the trial, and the presentation of the trial. And this was unique and is still unique in terms of cooperative groups.
We started with a real nucleus of faculty at IU and community oncologists.
So with the formation of the Hoosier Oncology Group, this allowed us to have idea generation, not just from one little building at Indiana University, but to have idea generation from many different physicians throughout the state of Indiana initially.
And the barriers were easy to identify. Time. It takes more time as a practicing oncologist to participate, to enter your patients into a clinical trial.
The second barrier was how are we going to get funding for doing these studies? And the third barrier was were we going to develop the infrastructure?
In retrospect, the timing was right. You might say it was somewhat magical because it is hard to imagine that you could put together competing forces, different practices that were all vying to get patients from each other, and put them in a room and come up with something that could be cooperative. But if we're going to make any progress, we have to hand this off to a younger generation of physicians who need to move forward and take this on and continue our continued battle to fight cancer, to eradicate it, to make sure that this doesn't affect future generations, not only for our patients, but for our own families.